Welcome back everyone. In our last video, I introduced you to the remarkable potential of Cavadex for arterial health. Now today, we're going deeper, explaining exactly what happens inside your arteries, the difference between soft plaque and calcification, and why understanding this distinction is absolutely critical for your heart health. Look at these two types of arterial blockages. On the left, you're seeing soft plaque, like butter at room temperature. On the right, calcified plaque, hard as bone. Both dangerous, but in completely different ways. By the end of this video, you'll understand exactly what's happening inside your blood vessels and how Cavadex works to remove both types of plaque, starting with the most dangerous kind first. I'll also share Rebecca's remarkable story, how her narrowing aortic diameter actually began to improve after just months of treatment, something her doctor said was medically impossible. So stay with me because this information could literally save your life or the life of someone you love. So let's start by understanding our enemy. What exactly is soft plaque? So soft plaque is like a ticking time bomb in your arteries. Unlike calcification, which builds up slowly over decades, soft plaque can rupture without warning, causing a heart attack or stroke literally overnight. And here's what soft plaque is actually made of. 30 to 35% lipids, including oxidized cholesterol and triglycerides. 20 to 25% inflammatory cells like foam cells and white blood cells. 15 to 20% proteins and collagen. 5 to 10% inflammatory compounds. 10 to 15% dead cell material, and about 10 to 15% water. This unstable mixture is what makes soft plaque so dangerous. So think of it like a water balloon attached to your artery wall. It has a thin fibrous cap that can rupture with sudden exertion, stress, or for seemingly no reason at all. So when this cap breaks, the contents spill into your bloodstream, triggering immediate clot formation, which can block blood flow entirely within minutes. And that's why many first heart attacks are fatal. People didn't know they had the silent danger lurking in their arteries. You can't feel soft plaque building up. You can't see it without specialized tests. And most blood tests won't detect it until it's already causing problems. So now let's talk about calcification, the other form of arterial damage. So calcified plaque is literally your artery turning to bone, and here's what it contains. 20 to 25% calcium phosphate crystals, the same material in your bones. 25 to 30% lipids, including cholesterol, cholesterol esters, and phospholipids. 15 to 20% proteins, such as collagen, elastin, proteoglycans, 25 to 30% water, and 5 to 10% cellular debris and other components. So unlike soft plaque, calcified areas are actually hard, stable, and grow very slowly. They don't typically rupture suddenly, but they create a different problem. They make your arteries stiff like pipes instead of flexible living tissue. And this stiffness forces your heart to work harder with every single beat, gradually weakening it over time. It also raises your blood pressure and reduces blood flow to vital organs. Calcification is what shows up on a coronary calcium scan, the test many doctors use to assess heart disease risk. But here's the critical point many doctors miss. A calcium score only shows calcified plaque, not the more dangerous soft plaque. So you could have a calcium score of 0 and still have arteries full of unstable soft plaque just waiting to rupture. So how does one type become the other? Arterial damage typically follows this type of progression. First, damage to the inner lining of your artery allows oxidized LDL cholesterol to penetrate. Your immune system responds, sending in white blood cells. Now these white blood cells consume the oxidized LDL and become foam cells. Now more inflammatory cells arrive, creating a growing collection of soft plaque. And over time, as inflammation continues, calcium begins to deposit in the plaque. Eventually, this can transform into heavily calcified areas. Now, this process typically takes years or even decades. But here's what's fascinating. Your body is actually trying to heal itself. The calcium deposition in your body's attempt to stabilize dangerous soft plaque. It's essentially trying to wall off the danger. But the problem is, this solution creates its own set of problems as arteries become increasingly stiff and narrow. So now that we understand both types of plaque, let's talk about how Cavadex works on each. Now, Cavadex is a specialized form of cyclodextrin that works like a molecular scavenger. Its unique structure allows it to bind to and remove cholesterol and other lipids from your body. So when you use Cavadex, it primarily targets soft plaque first for a good reason. Remember that 30 to 35% of soft plaque is made of lipids, and Cavadex binds to these lipids and helps remove them from the plaque structure. As these lipids are removed, the plaque becomes smaller and more stable. The inflammatory process begins to calm down. Your body can begin clearing away the remaining cellular debris. But what about calcification? Well, remember, calcified plaque still contains 25 to 30% lipids embedded within. So Cavadex works on this component too, gradually breaking down the structure. As the lipid component is actually removed, your body can begin to naturally process the calcium deposits. So think of it like removing the cement that holds bricks together. Eventually, the whole structure becomes unstable and your body can clear it away. So what does the treatment protocol look like? So let me walk you through it step by step. So first, I recommend a baseline assessment. A CCTA scan stands for coronary CT angiography to visualize your arterial health. Advanced blood tests including oxidized LDL, LPPLA2, and MPO to assess inflammation. A standard lipid panel including ApoB. Then the treatment begins. Cavadex is administered as an enema, typically 1 to 2 times per day, and this method delivers the medication directly to where it's needed most. Initial treatment focuses on the first 4 to 6 weeks, where we often see the first signs of slight improvement. Most patients report noticeable changes within the first 1 to 3 months. Improved energy levels, better exercise tolerance, reduced chest discomfort if previously present, better circulation to extremities, but the full benefits typically require 6 to 12 months of consistent treatment. Now, soft plaque reduction typically occurs first 1 to 6 months. Calcification improvement takes longer, 6 to 12 plus months. And I recommend a follow-up CCTA or heart flow analysis after 6 to 12 months to document your progress. Many patients see significant reduction in both soft plaque and calcified areas. So now let me share a remarkable case study that demonstrates the power of this approach. So meet Rebecca, a 62-year-old retired teacher who came to me with a serious problem. During a routine ultrasound, doctors discovered her aorta was dangerously narrow due to plaque buildup, restricting blood flow from the heart. Now, her aorta had improved from a severely narrowed 1.2 centimeter to a healthier 2.1 centimeter in just 11 months after starting treatment. Now, her doctor was astonished, having told her that such improvement was medically impossible and that she would likely need surgical intervention if the narrowing worsened. Now keep in mind, I've had numerous patients over the past few weeks sharing details about their heart health improvements, and I expect more success stories to emerge that I will continue to share with you. Now keep in mind, Rebecca wasn't willing to accept their limited prognosis. She started the Cavadex protocol along with target nutritional support which contributed to these remarkable results. So after just 5 months, her follow-up ultrasound shocked her medical team. Her aortic diameter had improved from 1.2 centimeter to 1.7 centimeter. By the 11th month mark, it had widened to 2.1 centimeter. So her doctor initially claimed the first measurement must have been wrong. When the second improvement was documented, he simply said, "This isn't medically possible." But the results speak for themselves. Beyond the measurements, Rebecca experienced significantly more energy throughout the day, better mental clarity, improved walking distance without fatigue, lower blood pressure from 148/92 to 127/78, and perhaps most remarkable, increased flexibility and reduced joint pain. And Rebecca's story isn't unique. We've seen similar improvements in dozens of patients using this protocol. So how is this possible? The science behind these results is actually fascinating. When Cavadex removes lipids from plaque, it's not just making the plaque smaller, it's actually changing the entire inflammatory environment in your arteries. So as lipids are removed, inflammatory signals decrease, healing cells can access the area, your body's natural repair mechanisms can actually function again. Blood flow improves, delivering more oxygen and nutrients. And this creates a virtuous cycle where initial improvements lead to even greater healing. The energy improvements many patients report come from both better circulation and reduced systemic inflammation. And inflammation is extremely energy costly for your body. When it decreases, the energy becomes available for other functions. So the flexibility and joint benefits may seem unrelated, but they make perfect sense when you understand the arterial calcification and joint calcification share very similar mechanisms. By addressing one, we often see improvements in the other. So now let's be clear, Cavadex isn't magic and it isn't for everyone. So this approach works best for people with documented soft plaque or calcification, those willing to commit to at least 6 months of treatment, patients who combine it with proper nutrition and of course lifestyle, those who work with a knowledgeable practitioner to monitor progress. And it's not ideal for people with advanced kidney disease due to mineral balance concerns, those unwilling to use the enema delivery method, patients expecting overnight results, people with severe, immediately life-threatening blockages. These require immediate medical attention. So what should you do if you're interested in this approach? First, get properly assessed. Ask your doctor for a CCTA scan or heart flow analysis. Request advanced inflammatory markers like LPPLA2, MPO, and oxidized LDL. Get a standard lipid panel including ApoB. Book a consultation to review your results and create a personalized protocol. Commit to the process. Remember, arterial disease develops over decades. So reversal takes time, typically 6 to 12 months, even more. Follow the complete protocol, not just Cavadex alone. Anti-inflammatory nutrition, target supplements, appropriate movements and stress management, and regular monitoring of your progress. Remember, your arterial health didn't decline overnight and it won't be restored overnight either. But with consistent application of these methods, we've seen remarkable improvements in few patients. Improvements many medical professionals still consider impossible. Whether you're dealing with soft, unstable plaque or long-standing calcification, there is hope and there's a path forward. So if you found this information valuable, please give this video a thumbs up and subscribe to my channel for more evidence-based strategies to optimize your health. And if you've used Cavadex yourself, I'd love to hear your experience in the comments below, and don't be afraid to share your positive and negative thoughts. So until next time, this is Maurice wishing you health and clarity on your journey.